I'm just going to talk a little bit about our experience with the community health promoter. So we actually got to sit in on a meeting one day with the health promoter who is in the rural community of Casablanca. And they were talking to the women, and there was a couple men there, about disease prevention through mosquitoes. So basically, I guess a big problem in the community is trash. So trash is left laying around, which attracts mosquitoes. And they also have a lot of water pooled around, so that is a breeding ground for the mosquitoes. And one of the other breeding grounds is their water holding tanks. So basically, a lot of them have big concrete tubs in which the water sits in because that's their only source of water. A lot of them don't have running water in their homes, so they'll catch runoff or drainage to go into these big concrete baths, and then they'll use that water for washing or to take out and use for other things. So basically, the health promoter came in and kind of told the women that they need to properly dispose of their trash, that they need to be sure to empty all of any like left standing water. And I also thought it was really cool that they were actually giving out packets for these families to put in their water baths to prevent mosquitoes from growing. And they also told them that like they didn't have a lot of packets, but that if they ran out of packets, that they can also use like a bleach solution. Obviously, you wouldn't drink it. This isn't for drinkable water, but they would use a bleach solution, and this would help kill the larvae to prevent any more mosquitoes. They also taught them to bury certain trash, and that certain trash could be repurposed, such as like water bottles. And we actually saw a lot of this repurposing of water bottles in one of the houses. We saw them use it kind of as like a fence or a border around a garden, which I thought was kind of neat. And so it was just kind of cool to see how the health promoter can go into the community and they hold these meetings. And another thing that the health promoter also talked about was that they were going to fumigate for the mosquitoes, which I thought is a great thing that Asa Prasar is doing for the communities, is paying for the fumigation to help prevent cases of dengue fever. I guess there was one community in which multiple families or multiple members of one family had been diagnosed with dengue fever, and it's really important to prevent these diseases, so education is extremely important, and it's even better that it's coming from a trusted leader in the community, because then I feel as though the community members will be more receptive to what they have to say because they're also living in the community and they have the same stakes as all the other community members.